Whether it be a major injury or a low-level dysfunction, the body needs to repair it. This section is covered in Unit 3, Section 2 of your manual and outlines the healing process. This is a complex process, but with clear stages, which as a massage therapist you are able to utilise and adapt your treatment to get the best effects of massage. It is also important that all post-massage care advice is in line with the phase of injury repair, and therefore a good understanding is particularly helpful. I should note here, however, that as a Level 3 therapist you are not qualified to treat injuries, although you can work with associated and supporting structures. It is therefore useful to have a good network of people to whom you are able to refer to get better results from your own treatment. The healing process can be divided into 3 main stages. Stage 1 is the inflammatory phase, Stage 2 the sub-acute phase, and Stage 3 chronic. Each phase will vary in duration depending on the severity and location of the injury, with smaller, more localised issues reaching each stage earlier, such as a small muscle tear or adhesion, while a full rupture, for example, will take much longer. We will look at each stage in turn. The acute stage will last around 3 to 7 days. This starts with inflammation or swelling in and around the affected area, be it an area of tissue damage or foreign body. Swelling, referred to as edema, is the body's most basic attempt to protect itself. It works by effectively providing a cushion to further impact and will normally limit movement, as this can cause pain on contact or activity. This will enforce a period of rest and acts as an inflammatory marker to initiate healing. There are a variety of symptoms that will indicate the acute stage of injury. The severity of the symptoms will depend on the severity of the injury, but things to look for include pain, visible swelling or a feeling of sponginess under the skin, heat, redness, reduced movement and loss of function. Any given soft tissue damage will have a different presentation, and therefore keep an open mind. People often see pain and inflammation as a bad thing, but in the case of repair, it really isn't. When a tissue becomes damaged, the local blood vessels are also damaged, resulting in bleeding into the surrounding areas, creating redness, swelling, and heat. As this occurs, the blood vessels will vasoconstrict in order to start to reduce blood flow to the area. As the blood flow in the area reduces, the localized cells are starved of oxygen. We say that the area has become ischemic. As these cells cannot survive without oxygen, they start to die off. Now this sounds like a horrible process, but in fact it is these dying cells that recruit the body's healing mechanisms. As the cells die, they release chemicals called histamines. This causes vasodilation of undamaged blood vessels and increases permeability of healthy tissue in the surrounding area, as well as blood flow to them. This increased permeability means that there is a significant increase in tissue fluid or interstitial fluid, or swelling, which will be visible on a larger area or often palpatable, and it will feel spongy. This fluid plays an important role in that it delivers nutrients, oxygen, white blood cells and platelets directly to the tissue cells in need. The fluid also plays an important role in recovery, as it will exert pressure on the nerve endings, causing pain and preventing movement. All these effects combined leave symptoms that can be very obvious or more subtle. Make sure you look for pain, swelling, heat, redness, and loss of function. Once you have reached this point, the body will start to reduce blood flow further through vasoconstriction, as it will wall off the area, shutting off the damaged blood vessels as the platelets become sticky and effectively plaster the area. These sticky platelets then release a chemical called thrombin. This chemical converts a blood component, fibrinogen, into fibrin, which can be deposited in the damaged area as a mesh to bind the area together. We call this a sticky matrix, and it will trap dead cells and further platelets in order to create a blood clot and therefore reduce fluid loss. It will also allow white blood cells to work, breaking down any bacteria or even just the dead cells in a process called phagocytosis. So as you can see, a lot happens in the first few hours and days after injury. The second stage of injury is relatively straightforward. You might be pleased to hear this. In order for the cells and tissue to be supplied with oxygen and nutrients, new blood vessels start to form within the area. This will be combined with the formation of lymphatic vessels, which will start to drain interstitial fluid from the area. Fibroblasts, which are cells that are able to produce collagen, migrate to the sticky matrix and begin to lay down new fibres. This is important as they will lay down in accordance with the tensile stresses that the muscle is under. This is partly why active recovery is increasingly prescribed, because as you move a muscle, you will put it under a degree of stress, and therefore the muscle fibres will begin to be laid down in the correct direction. If there is no stress applied to the tissues, the fibroblasts will lay down collagen in a haphazard fashion. Think about builders filling in a hole and just putting the collagen down quickly and in any direction. It may take longer to organise it properly, i.e. a longer recovery, but in the long term this will provide more effective recovery. If the fibres are left irregular, then the injury cycle is likely to continue and recovery will be poor long term. Too much stress, however, and the area will not be able to reconstruct, and therefore further injury will occur. This is a really important point, as people will often ask you how much is too much. My basic answer is that if it hurts, don't do it, but managing rehabilitation should be done alongside a physio. Once laying down, the collagen matrix will begin to contract, pulling the damaged tissue together. The last stage of repair is the chronic stage. By this point, most of the new collagen fibres have been laid down, although only about 20% of the pre-injury strength has been redeveloped. During this stage, further collagen fibres are laid down to further strengthen the scar tissue. As tensile stresses are further applied, the fibres continue to contract and align to these stresses, creating effective remodelling. As stress increases, the body will continue to strengthen in order to meet these stresses, allowing normal function to return. The scar tissue will be improved through treatment. However, because collagen lacks the elasticity of non-injured tissue, it will only ever reach around 80% of its original strength, creating a long-term point of weakness, and therefore probability of injury recurrence is higher. The remodelling process can take up to 2 years, depending on the severity of the injury. There are a few factors that will impact the rate of recovery. The first of these is the severity of the injury. Naturally, a mild injury will take days to recover, while a rupture could be years of recovery. The next, of course, is the intervention. If someone has good physiotherapy and massage integrated into the recovery process, then this is likely to enhance the rate of recovery, and definitely the effectiveness. However, this also relies on the client adhering to the rehabilitation plan in place. On that note, adherence to an exercise plan can be really important. We've already mentioned the importance of active recovery. However, if people do not do enough or do too much, this will impact their recovery process. Rest is also required in order to heal the body, and therefore a balance is really important. This can be very difficult to achieve. Other factors include medication. Painkillers and anti-inflammatories can mask pain and actually slow healing as people stress the area too much. By reducing inflammation too quickly, you slow the body's natural process. Side effects from some medication may also slow healing. Nutrition is a key factor. If someone has a poor diet, then their rate of recovery will be compromised. This is relevant to both macro and micronutrients, as you saw in Unit 2. This means that people with eating disorders will often heal slower. The final factor, and one that you cannot impact, is someone's age. As people age, the healing process does in fact slow, meaning that for the same injury, more time will be required. In older individuals, pain and immobility can trigger other issues that have been perhaps festering for a little while, and therefore secondary injuries are common. By understanding the way in which the body heals, you as a therapist will be able to alter your massage to increase the effectiveness of recovery and this is hugely important. Make sure that you build this into your plan and get lots of information from your client and other involved therapists to make recovery as effective as possible. You will now have all the information to complete the worksheet for this section and should be able to answer the questions. Although this will not be assessed outside of the worksheet, it will make a big difference to you when massaging. So if you have any queries, then do just ask us.